Hi viewers, welcome back. In today's video, we are going to talk about sub-involution. So, we have seen or we have discussed about the involution in the previous class. So, now we will talk about sub-involution. The term says sub-involution is the involution which is lesser. That is like when you compare to the normal involution, this involution is less. So, involution has not taken place properly. So, at that time we say it is sub-involution. There is also a term called as super-involution. Super-involution is involution which is more than the normal. That is super-involution. This happens when the mother is feeding too much or when the feeding is adequate. Sometimes due to lot of postnatal exercises also this can take place. But sub-involution is a common condition and you have to provide care to the mother, or otherwise it can cause serious issues with the mother. So, the first thing is like factors causing sub-involution. So, factors causing sub-involution in the sense, first there may be an inadequate uterine contraction and there may be some bits which is remaining inside the uterus and which is triggering the bleeding episodes, and when there is a continuous bleeding and when the process is not complete, the involution will not take place properly. Sometimes it is because of infection also, there may not be an adequate involution taking place. So, now we have the predisposing factors. So, the predisposing factors, when you come, the first cause is the grand multiparity. Grand multiparity in the sense, the mother who is having many number of pregnancies. So, a lot number of children are more, the number of conceptions are more. So, you say it is grand multiparity mother, and the mother who have an over distended abdomen. Over distended abdomen is because, why over distended? It may be either because of twin pregnancy, polyhydramnios, maybe in any condition where there is an over distension, and when there is an over distension, the involution process will take time. It will take a time that is like sometimes it will take a longer period, more than 6 weeks, or sometimes it may not even take place completely. So, a part of involution will stay back like sub-involution. And then we have ill health of the mother. When the mother is not adequately nourished, when the mother is having anemia, when the mother is not having sufficient nutritional factors. So, when she is unable to take care of her health due to some other health issues, so at that time can also happen. And sometimes it is because of LSAs. So, when the mother has undergone a lower cesarean segment, so at that time what happened? The muscles, it will take time. So, because like normal delivery, the normal puerperium takes place. So, now this is an artificial opening we have done, and this will take time for healing. So, you have to give time for this involution to take place. Sometimes this involution will take time and it will go to the normal stage, or sometimes it will become sub-involuted. So, anyway you have to think about. And then we have the prolapse of the uterus. So, when we consider the prolapse of the uterus, when the baby is coming out with a lot of pressure, at that time what happens? Not only the baby comes out, the baby comes with lot of pressure, and the uterus also, the fundus is also coming down. Sometimes that will happen and there may be prolapse. So, when there is a prolapse, what happens? You are going to take the baby out and you will put the uterus inside. So, you will be pushing the uterus inside like this. You will push and you have to give pressure so that the uterus stays back inside. So, in this condition also there will be a sub-involution. And then we have retroversion. Retroversion in the sense the uterus is not in the normal shape. So, uterus, it is in the anteverted portion. We know the normal anatomical position is anteverted uterus. That is like the uterus will be like this, and like little to the front there will be a mild bend in the front. So, that is your anteverted. Sometimes what happens, instead of being like this, it will be like this. So, what happens? The uterus is like it goes and gets inverted like this. So, this is your retroverted uterus. and those type of uterus. And then when there is an uterine fibroid, so when there is a fibroid, the blood supply to the uterus is not stopped, as because the fibroid is there inside, there will be a continuous blood supply to the uterus, and because of that the uterus will think there is something inside, maybe it is the baby, and it keeps on growing and it doesn't have that involution process taking place. So these are the predisposing factors, and then we have the aggravating factors, that is like some factors which will increase the condition. So those factors are your retained placenta, when there is some bits of placenta or membranes inside the uterus. So what the normal body mechanism, the body tries to push the fetus or the bits or membranes which is remaining inside the placenta. So it keeps on bleeding, and what happens? So this involution process will be delayed. And then we have sepsis, when there is bits remaining, and when there is a long term healing process, there may be an infection to the mother, and because of that there may be a subinvolution. And then we have endometritis. Endometritis in the sense when there is the thickening of the endometrium takes place, where the involution becomes very slow to heal. So that is with your aggravating factors. So we have seen the factors causing, the predisposing factors, and the aggravating factors. Then we have the symptoms. So how do you identify it as subinvolution? See, we said there must be a bleeding for the fortnight. So within 2 weeks there will be bleeding, and the bleeding has to stop after the delivery process. In case if the bleeding is proceeding, if the mother is having continuous bleeding, or otherwise she is having episodes of bleeding in between, sometimes when there is a crampy abdominal pain, all these things indicate there is something abnormal with the uterus. So you have to think, and you have to suspect for subinvolution. And then we have signs very clear. When you measure the fundal height, you can just check and see whether the fundus is involuted adequately or not. With that you can say it is subinvolution. And then we have management process. When we come to the management, we have 3 areas. When you suspect infection, you have to start with antibiotics. So you have to start with antibiotics which can treat the infection, and once you start treating the infection, the process will come down. And in case if antibiotics are not sufficient, then you have to go in for exploration of the uterus. So exploration of uterus is like you are going to see what is happening inside the uterus, whether some bits of placenta or membranes are remaining, or otherwise whether it is endometritis, something which is causing subinvolution. So you have to rule out, so you have to see, that is like you have to explore the uterus for some cause. And then finally comes the ergometrin. So ergometrin, they are going to promote uterine contraction, so thereby the blood flow increases and you can see the involution taking place normally. So with this we complete subinvolution, where we have seen what is the meaning of subinvolution, the causes, predisposing factors, aggravating factors, the signs, symptoms, and the management of subinvolution. Okay, so let us discuss some other topic in the next class. Till then, take care. Bye.